evaluation. Now, preoperative preparation of the patient. So everything we will talk about is aimed to prepare the patient for surgery. What does that mean? That means to decrease the operative risk of the surgery and anesthesia. So to decrease risk of the surgery and anesthesia. Evaluation of general health of the patient is very important. Last time we discussed the diagnostic process. So history taking, physical examination, laboratory examination, and instrumental examination. Now we must discover some risks of the surgery and anesthesia. So, of course, complete history and physical examination, which we, I hope, already did in this imaginary patient. And now we must ask about the bleeding tendencies. So some patients have a history of bleeding. So insignificant trauma, which does not lead to any bleeding in other individuals, can lead to bleeding in this particular patient. It can indicate the abnormalities of the coagulation system of the patient. So you can ask if we routinely make the preoperative blood test for the coagulation cascade. It is coagulation panel or coagulogram. So why such questions are necessary? So some hematologic disorders cannot be relieved by coagulation panel, ordinary coagulation panel, and can need special kind of tests. That's why we must ask about this to the patient. Recently, about 45 days ago, I operated the patient. He was West European citizen of one of the West European countries. He was traveling in Iran, Georgia, Armenia, and stuck here because of coronavirus. And he was admitted to the emergency department of our hospital with severe state and quite strange condition. This patient, during preoperative interview, the patient mentioned that he has bleeding tendencies, and his main complaint was abdominal pain and distension. He had rare kind of hematological disorder, rare kind of hematological disorder, thrombophilia, but several types of thrombophilia are quite common, but his condition was rare because he had abnormality, or not deficit, but abnormality of the factor 8 and deficit of factor 5 together. So two different conditions in the same patient. He was on anticoagulant to prevent the blood clotting. This is warfarin. and this patient got this warfarin for several years. But this is the medication which blocks the synthesis of the coagulation factors in liver. That's why it needs control of the coagulation state, but he just received the same dose all the time. This caused the poisoning with the warfarin and bleeding, intra-abdominal bleeding. Okay, so it's very important to ask about the bleeding tendencies. Medications currently being taken by the patient. For example, the patient has high pressure, high blood pressure, and takes medication, and it is more important during the emergency surgery, and you just have no information about the previously taken medications and inject hypotensive medications, and too much hypotensive effect can lower the blood pressure too much. So that's why doctor must have information about the medications which the patient got before surgery. It could be anti-diabetic medications, hypoglycemic medications, anti-arrhythmic medications, and so on. You must ask the patient about the allergies and reactions to medications and food. It is very important. Some patients have previous history of allergy, and you know from the immunology that the second contact with the allergen can be fatal, because sometimes it leads to the anaphylactic shock, anaphylactic reaction. Because during first contact, the organism gets, or immune system gets rises its sensitivity against the allergen, and during the second contact, already released antibodies launch the severe allergic reaction of immediate type.
Can I ask a quick question?
Yes, sure.
Regarding anaphylactic shock, like what kind of medication can be given in that case, like emergency medication?
Okay, we will discuss this a bit later.
Okay.
Yes, it is quite a definite guideline about the anaphylactic reaction, and in the operating theater, as well as in the small operating theater, which is dedicated to the small surgeries, always anti-allergic and medications which are necessary during anaphylactic shock are stored in the room and ready for injection, because the patient, if the patient has previous history of allergy, of course, during history and during interview, the patient can tell such information, but sometimes patients have no information about the allergic reactions of medications. That's why such medications and equipment are always ready in the medical facilities which inject some medications, including the operating theater. Okay. History of embolism. Bleeding is a serious problem during surgery, but also overcoagulation is serious problem because thrombos formed in the vessels can travel along the bloodstream. This is called embolism, and in case of deep vein thrombosis, deep veins of the pelvis and lower extremities, legs, these thrombos can travel along the inferior vena cava to the right atrium, then to the right ventricle, and the first network on this way is the lung parenchyma. So they stuck in the branches of the pulmonary artery. This could be small thromb with the development of lung infarction, or large thromb, which complete cessation of the blood circulation and sudden death. Neurological examination is necessary in some patients. It depends on the surgery and also patient's history. Assessment of peripheral arterial pulses. So carotid artery, radial artery, femoral, popliteal, and so on. It's easy to estimate the circulation and atherosclerotic or other kind of damage of arteries, peripheral arteries. How to assess the volume of the circulating blood? So patient can have overload of or too much fluid circulating in the bloodstream, or deficit of the circulating blood volume. So you can judge about it. Of course, there are very sophisticated methods to determine that, but we're talking about the simple measures to quickly assess the patient's state. It is fullness of neck veins in supine and erect positions. So distension of veins means that patient has too much fluid circulating in the bloodstream, especially if they are distended even in erect position. Also, orthostatic changes in blood pressure and pulse are good method to determine the deficit of the circulating blood volume. Especially asthenic individuals, if get up quickly from the bed, can even lose consciousness because the heart cannot adequately pump the blood till the brain, and because of brain anemia and ischemia, they lose consciousness. Also, any kind of a patient, not only asthenic, can have dizziness or even loss of consciousness during hypovolemia, during the orthostatic changes. Also, history of fluid loss is important. For example, vomitus, diarrhea, use of diuretics. Such history can indicate the deficit of the circulating blood volume. Besides the routine examination, it's necessary to make complete blood count and serum electrolyte measurement for the patient over 40. And for the patient over 50, chest X-ray, non-contrast investigation, just anterior-posterior X-ray, and electrocardiogram is necessary. because the likelihood of diseases of the respiratory system and diseases of the cardiovascular system rises over the 50 years of age. About other specific tests, so liver function, kidney function, psychiatric consultation, such measures are necessary only in selected cases. So during preoperative evaluation, you must determine necessity of such investigation. You can quickly assess the kidney function by creatinine level, but if the patient has history of kidney diseases or the creatinine level is abnormal, then you must make more precise investigation. Storing of autologous blood. It is also a good method. The principle of this method is following. So the patient is admitted to the hospital, and about 500 milliliters of blood is stored of the patient, blood of the patient, and it is replaced with a saline solution. So patient has no deficit of circulating blood volume after this procedure. During surgery, which sometimes is bloody, for example, thyroid surgery, it depends on the method of the thyroid surgery. So after bloody surgery, patient loses less red blood cells because his blood is diluted with saline. And after surgery, the patient's own blood is transfused to the same patient. So it is returned back. By this method, patient loses less red blood cells during surgery. This is the same. Okay, so now specific factors affecting the operative risk of the patient. Just a second, I will review the okay. So malnutrition is the serious risk factor of the surgery because during malnutrition and during deficiency of the protein, vitamins, and building materials of new tissue, the healing process after surgery fails. That's why we must reveal the cases of malnutrition and somehow compensate it. So how to detect if the patient has malnutrition? First of all, it is the weight loss, more than 20% of body weight in a short period before surgery. Such deficit increases the mortality after surgery, also increases the postoperative infectious complication rate because malnutrition patients have decreased ability to produce immune antibodies, and their general immunity is quite depressed. Other measures to determine the malnutrition is serum albumin level and transferrin level. Okay, now how to compensate malnutrition, how to decrease the operative risk caused by malnutrition. It is hyperalimentation, or what does that mean? We must give the patient calories more than necessary. This is called hyperalimentation. But how can we give calories? First of all, of course, it is oral feeding. But if it is not possible because the patient's condition, patient's disease, then it is possible to insert feeding tube in stomach. It is called gastrostomy, or in small gut, enterostomy, for feeding. And the food and nutrients are injected into this tube. Also, total parenteral nutrition. It is the method when enteral feeding is not possible, then nutrients are injected intravenously. So nowadays there are some solutions for total parenteral nutrition which can be injected in the peripheral vein, but most such solutions cause irritation of the peripheral vein. That's why central vein catheter is placed in the subclavian vein or internal jugular vein, and patient is feeded through the catheter. Okay, other factors affecting operative risk: immune competence, so immunodeficiency of the patient. So it's very difficult to estimate if the patient has immunodeficiency. Why? Actually, such thing, patient's immune competence, does not exist at all. Immune system is always specific. Patient can have immunity against one antigen and fail against another antigen. Okay, but it is well known that several conditions lead to the depression of the immune system and rises the rate of infectious complications. These risk factors are elderly age, so elderly patients have relatively low immune state than young patients. We already said that the malnutrition decreases the resistance against infection. Several trauma or burns. Cancer also leads to immunodeficiency because it demands, during the quick growth, the cancer demands nutrients, vitamins, and everything. And always in cancerous patients, there is a deficiency of nutrients and vitamins and microelements. Immunosuppressant drugs are used to suppress the cancer. They also suppress the cells of the immune system, because immunosuppressant medications actually aim cells which divide, which multiplicate, so they mean cancerous cells. But in the organism of the patient, also there are some other cells besides cancerous which quickly divide. And this is the cells of the brain marrow, lymph node cells, and cells of the reticuloendothelial system. That's why immunosuppressant medications have side effects, and one of the side effects is the decreased immune competence. Corticosteroids, sometimes it's necessary to continuously give the patient corticosteroids orally or intramuscularly or intravenously. For example, it is necessary during the transplanted organ or rheumatological autoimmune diseases to suppress autoimmunity. So besides autoimmunity, corticosteroids suppress general immunity against infection. Cytotoxic agents also are used mostly during rheumatological diseases. Prolonged antibiotic therapy. Kidney failure. During kidney failure, the main function of the kidney fails, so it is detoxification, isn't it? Kidney removes toxic substances from the body. So these substances circulating in the bloodstream depress immune system. Granulocytopenia of different origin. It could be toxins or hematological oncologic diseases like lymphoma, leukemia. They cause also decreased resistance against infection. And uncontrolled diabetic mellitus. During uncontrolled diabetic mellitus, always the patient has immunodeficiency, some immunodeficiency. That's why infectious complications are rather common. Pulmonary dysfunction. So pulmonary function as well as cardiovascular system is the vital system. So the patient can live with depressed immunity, for example, but with the abnormal pulmonary and respiratory function and cardiovascular function, it quickly leads to the complications and even death of the patient. So we must estimate if the patient has compromised pulmonary function and somehow compensate it to decrease the operative risk. First discover the risk, then decrease the risk. So what can depress the pulmonary function? So there are many conditions, but very common condition is smoking. Smoking causes chronic inflammation of the bronchi, and with if it lasts for several years or even decades, then it completely destroys the small bronchi, causing obstructive syndrome. And how to reveal pulmonary system dysfunction? First of all, it is hypoxia. We must quickly test blood gases, and abnormal blood gases means that something is, of course, it has several reasons, but one of most reasons is pulmonary dysfunction. Atelectasis of the lung. So lung is collapsed. One part of the lung is collapsed. This is called atelectasis. It happens because of several reasons. For example, pain can cause lack of deep inspiration, because inspiration could be painful, and lung atelectasis, or it could be positional, when the patient is in the same position in bed and does not move from one side to another. Then in the lobes of the lung, which are located lower against the bed, atelectasis develop. Pneumonia is the bacterial inflammation of the lung parenchyma, which also decreases the area of gas exchange and compromises pulmonary function. We must ask about the smoking, and in case of smoking, how much patient and how long patient smokes. History of cough, also obesity affects, morbid obesity affects the respiratory function. Advanced age. With age, emphysema develops in lung tissue, which compromises the function. And we must ask about the history of pulmonary diseases. Exercise tolerance is good test to review pulmonary dysfunction, because the patient can have compensated pulmonary function at the rest, but the reserve could be affected. That's why during exercise, lung fails and respiratory failure develops. Now about the investigation. It's a chest X-ray, ECG, blood gases and electrolytes, pulmonary function tests. So most important pulmonary function test is spirogram. Spirogram is the method of investigation when patient expirates in special device, which is connected to the computer, and everything is recorded. Parameters of the respiration are recorded. So most important parameters are forced vital capacity of the lung and forced expiratory volume in 1 second. Measurement of the arterial oxygen and CO retention are important markers of the healthy respiratory system. Before surgery, we advise the patient to stop smoking. Even few days of abstinence improves the respiratory system efficiency. And also sputum released by the bronchi decreases, but after 5-7 days of cessation, the amount of sputum can increase again for a few days. Oral or inhaled bronchodilators are used in case of bronchospasm. And after surgery, mainly after surgery, it is important to make physical therapy and postural drainage. What does that mean? So postural drainage means we turn the patient from side to another side, and bronchial secretions from the lower lung areas become flow to the trachea, and it's easy then to remove. And chest physical therapy means using the special devices which create positive pressure during expiration to expand the collapsed lung. So these measures treat atelectasis. And also just massage of the chest wall improves the blood circulation inside the blood lung tissue and improves respiratory function. Delayed wound healing. So it's important after surgery to facilitate wound healing. It is mostly important on intra-abdominal organs, on intestines, or intrathoracic. It could be bronchus or blood vessels. Otherwise, these sutures can fail. So failing of sutures on the gut leads to the leakage of anastomosis or sutured area, leakage, and peritonitis, which is the surgical emergency. Leakage or so-called secondary leakage, secondary bleeding from the sutured blood vessel also, blood vessels also is very high emergency, and it can kill the patient because it can be detected quite late. How to facilitate wound healing and which factors affect wound healing? First of all, it is protein depletion, because amino acids are building blocks of new tissue. So wound healing actually is building new tissue. So protein deficiency causes delayed wound healing. Ascorbic acid deficiency, vitamin C deficiency affects wound healing. Dehydration or deficit of the water or edema affects wound healing. Severe anemia. So in order to facilitate healing, the tissues must be well oxygenated, or blood supply, oxygen supply is necessary for young connective tissue, which heals the gap between the edges of the surgical wound. That's why anemia, severe anemia, affects wound healing. Diabetes mellitus affects small vessels, small caliber vessels. This is called diabetic angiopathy, and because of diminished blood supply, it also affects wound healing. And smoking causes spasm of the capillaries, precapillaries, and decreases blood supply to tissues. Large doses of corticosteroids also affect wound healing. Chronic diuretic therapy causes dehydration, and that's why delayed wound healing. Myocardial dysfunction also decreases the supply of tissues with oxygen. Chemotherapy, so chemotherapeutic medications, as already said, suppress any dividing cells, including young tissue in the surgical wound. That's why they affect wound healing. That's why after oncological surgery, after removal of the cancer, we start chemotherapy, not immediately after the surgery, but after the healing of the surgical wounds. And irradiation, radiotherapy. So radiation therapy is important part of the therapy of oncological patients, and it is used preoperatively or postoperatively. So if it is used preoperatively, then 2 to 12 weeks are necessary before surgery to decrease complications caused by the irradiation, including delayed wound healing. So main reason for the delayed wound healing is decreased perfusion, decreased oxygen supply, and as a result, delayed wound healing. Now, risks of thromboembolism. I described already what is the thromboembolism, so deep vein thrombosis and embolism of the pulmonary artery. Several conditions increase the risk of thromboembolism. This is cancer. So I recently operated a woman. So she had cancer of ovaries, of both ovaries. So 2 years ago, gynecologists removed ovaries and lymph nodes. But now, after 2 years from previous surgery, the patient developed relapse in the Douglas pouch area or the small pelvis. And this cancerous tissue was infiltrating the rectosigmoid junction. That's why I was called in the operating theater. I resected the rectosigmoid junction, closed the rectum, sutured the rectum, and made colostomy from sigmoid colon. And after discharge of this patient, I prescribed high doses of the fraxiparine. Fraxiparine is low molecular weight heparin. The patient has no tendency of thromboembolism, no history of thromboembolism, but because she has cancer, and also because she was operated on small pelvis, these two factors increase the risk of thromboembolism. That's why I prescribed low molecular weight heparin, fraxiparine, in high doses for 20 days. Obesity also increases the risk of thromboembolism. Myocardial dysfunction. First of all, it is supraventricular flutter, atrial flutter, actually. During atrial flutter, atriums of the heart does not squeeze as in normal situation. After contraction, some amount of blood remains inside the atria. This leads to formation of small thrombi inside, and these thrombos from atria, the left atrium, can get the left ventricle and then to the aorta. You know that aorta distributes the arterial blood all over the body. That's why these thrombos can be passed to any vessel and obstruct any vessel, including vessels of the brain with subsequent ischemic insult, brain ischemia, or heart causing myocardial infarction if they occlude the coronaries, or kidney, or eye, or any organ, or extremities causing gangrene of the leg or arm. That's why myocardial dysfunction is the risk of the thromboembolism. Age is also age increases the risk of thromboembolism, because with age, atherosclerotic damage of the arterial vessels increase. So atherosclerotic NASes are found in young individuals also, individuals of about 15 years old. But incidence in young age is low, and with age, incidence of atherosclerotic damage of vessels increases, and the likelihood of thromboembolism also increases. Prior history of thrombosis is also a risk of current thromboembolism. Dopplerography, it is the Doppler ultrasound or triplex investigation, it's called sometimes. It is the ultrasound investigation which measures the patency and estimates the blood flow in low veins of the lower extremities and pelvis. Doppler ultrasound. So we can find thrombos inside the deep veins of the leg or pelvis, and somehow prevent embolism. For example, with placement of the filter in the inferior vena cava, or not allowing the patient to walk for several days. Cardiac ultrasound can reveal thrombosis in the atrium of the heart, and thus prevent development of embolism. Compression stockings are used to prevent thromboembolism. Compression stockings compress legs, and we have three kind of veins in legs. It is superficial or subcuticular veins, deep veins, and communicating veins. So when stocking compresses the superficial veins, blood is redistributed to the deep veins, and blood flow in deep veins increase. And because of this, likelihood of clot formation and subsequent embolism also decreases. Heparin is used to decrease the blood coagulation ability. But unfractionated heparin, so-called ordinary heparin, is unfractionated heparin, needs control, strict control. The blood test, which is used to control the blood coagulation state, is called APTT, activated partial thromboblast in time. But low molecular weight heparin does not need such strict control, and then can be used after discharge of the patient at home. And yearly walking. Our muscles act as a pump for deep veins. So when we walk, we squeeze our muscles, and this squeezes deep veins of the leg. And because of the valves inside the deep veins of the leg, the blood flows towards the heart, and such increased blood flow decreases likelihood of the thromb formation. Elderly patient needs special treatment. So because their cardiovascular system, respiratory system, muscles, joints have changes which are associated with age. It is not necessarily disease, but just healthy elderly patient with the changes in these systems which are associated with age. And it is normal because everybody will develop such changes. And first of all, it is decreased reserve of the heart. So if you infuse intravenous fluids in young individual, the heart quickly adapts to the preload, increases minute volume, and pumps this fluid on the other side. But elderly people can develop congestion of the blood, especially in the pulmonary artery, leading to pulmonary edema. That's why we must monitor the speed of fluid infusion in every patient, but especially in elderly patients. First of all, we must monitor the fluid intake, fluid output, body weight, to avoid over-transfusion of fluids, also serum electrolytes, and also central venous pressure. During the overload with fluid, central venous pressure increases, and this is the parameter which is very easy to measure at the bedside of the patient if the patient has central venous catheter. Also, sedative and hypnotic drugs must be carefully used in elderly patients because they can lead to adverse effect. Instead of sedation, they can use restlessness, mental confusion, uncooperative behavior, aggressiveness. That's why they must be used only if they very really necessary. Okay, now about the operative consent. So we already talked about this during our previous lecture. How to get the consent from the patient. First of all, patient must trust you to sign the consent because you operate on his or her body. That's why trust is necessary. If the patient sees that you are a suspicious person, or in patient's opinion, you are incompetent, or patient doesn't like facilities, then patient can refuse and does not sign the consent. So first of all, you must talk with the patient, establish contact, establish trust, and you must estimate patient's psychological state, how to talk with the patient. For example, some patients, the best way to talk with some patient is that just natural way of talk, just like with your friends, or you can even tell the joke. But some patients does not accept such treatment, such talk. You must be official, and any joke can only spoil everything, because in case of joke, the patient can lose your trust. That's why you must estimate the personality of the patient and psychological type. You must explain the nature and purpose of preoperative studies and treatment itself, surgery itself. You must describe in details the procedure, the stages of the procedure. Also, it's important to disclose alternative ways of treatment. For example, the patient, you are going to operate the patient because of acute appendicitis, and the methods are different. For example, you can make open appendectomy or laparoscopic appendectomy. You must describe both, and patient must choose which method patient likes. Or if you think that this method is appropriate, not the other, then you must explain why. Why open method is better for this patient if the laparoscopy leads to less pain and quicker recovery, because this patient has abscess, purulent infection, which needs washing out the abdominal cavity, needs dissection in the retroperitoneal space, and placement of drainage. So you must explain why you don't use alternative methods of treatment. You must also describe the possible consequences and possible complications. And your speech must be clear to the patient. You must not use very sophisticated words. You must just explain the nature of the procedure and alternative procedures in acceptable words. Okay, blood transfusion. So there are some people which refuse blood transfusion because of religion or other reasons. So you must say that to the patient that sometimes it is necessary to transfuse the blood to save the life of the patient, and the patient can accept this and sign consent or refuse. But you have obligation to tell the patient about such possibility. Okay. What if the patient is unable to sign the consent, or patient is unconscious, or patient is child? So in this case, you must find somebody which have permission to sign such consent. It could be legal guardian of the patient, or parent of the patient, or family member. In case of life treatment situation, you must make surgery without any consent and save the life if the patient is unconscious or somehow unable to sign. Again, evaluation of the hemostasis. So, history of bleeding tendencies.
By the way,
sorry?
You stop presenting, we don't see the screen.
Okay, just a second. Is it okay now?
Yes.
Hello?
Yeah.
Epistaxis means nasal bleeding. gingival bleeding, bruising, ecchymosis, menorrhagia, or bleeding from the during the menstruation, prolonged menstruation, or too much blood during menstruation. These are important. This is the important information about the bleeding tendencies of the patient. Also, some medications affect blood coagulation. First of all, it is aspirin and other non-steroidal anti-inflammatory drugs. Clopidogrel and warfarin. I mentioned warfarin, describing my foreign patient. This is anticoagulant medication. Coagulation panel is necessary in every patient before surgery. Most important components of the coagulation panel is prothrombin time, and more modern variation of this analysis is INR, International Normalized Ratio. This is actually the same value, but presented in different way. And APTT, activated partial thromboplastin time. And bleeding time. Unfortunately, bleeding time does not predict surgical bleeding. It just tests the initial thrombin formation, just aggregation of the platelets. It is initial stage of hemostasis, but does not reveal abnormalities of the coagulation cascade. That's why first two parameters are much more informative. Now let me describe prevention measures of the surgical infection. So every kind of surgery means incision, and incision can get infected, and microorganisms inside the wound will develop surgical site infection, which can cause mild discomfort or even kill the patient with sepsis. That's why it's very important to prevent the surgical site infection, prevent or protect the wound from environmental infection. Development of the surgical wound infection is based on three factors. It is resistance of the organism, because the immune system is dedicated to fight against infection. Also, virulence of microorganism is important, and the amount of microbial bodies. Too much microbial bodies can lead to surgical site infection. Too small amount can be eliminated by the immune system. And now, how to use that for our purpose, for to decrease the operative risk. So today we are discussing measures how to decrease the risk of surgery and anesthesia, isn't it? Okay, so we cannot decrease the virulence of the microorganisms, but we can increase host resistance. We discussed already how to compensate the immunodeficiency of the patient, and also we can decrease amount of microorganisms which get the wound, surgical wound, during surgery. So it is a very important discovery in the history of medicine. It is Semmelweis. Semmelweis, he was Hungarian physician of German origin and worked in Vienna, Austria. And he was obstetrician. And after the delivery, most women developed puerperal fever caused by infection. That time, infection was not discovered yet. So women, mothers after delivery died because of fever, and they think it was normal. But Semmelweis had hypothesis that something which causes the puerperal fever is transferred by the hands of obstetrician from one patient to another. Imagine all obstetricians just in suits like on this picture here, without any gloves, gown, or anything, and they examined one woman with naked hands, and then maybe just use towel and examine another woman. And Semmelweis thought that obstetricians transfer something from one patient to another, something which causes fever. So his conclusion was right, but nobody had any idea what was transferred from one patient to another. So he introduced just it was hand washing. So he said that if you wash your hands before these two procedures, you decrease the likelihood of the puerperal fever on the next patient. Okay, and used chlorinated lime solution for hand wash. Unfortunately, nobody believed him. Nobody believed, and only after his death, Louis Pasteur reanimated this idea and introduced again hand wash. This is the scientific work of the Semmelweis, and in two clinics, he compared two clinics and mortality rates in two clinics. In this clinic was ordinary way of treatment, and here hand washing was introduced, and the difference is significant. So Semmelweis decreased the percentage of death of the mothers because of puerperal fever. That's why this is the monument in Budapest, Savor of Mothers. Okay, but during his life, he was forgotten. His ideas were forgotten, and only Louis Pasteur, Joseph Lister. I'm sorry, Lister introduced again antisepsis. So Louis Pasteur discovered microorganisms. So Louis Pasteur was the French scientist which discovered microorganisms and also found that under the microscope. So it was fascinating discovery which actually made modern surgery possible. Um, Lister was a young professor which used his charm and authority to popularize the same idea which was introduced by Semmelweis, the same idea. So to use antiseptic solutions to kill the microorganisms. So he used carbolic acid or phenol as antiseptic. He sterilized surgical instruments, cleaned wounds, cleaned surgeons' hands, and even sprayed the carbolic acid in the environment to decrease the quantity of the microbial bodies which get the wounds. Unfortunately, carbolic acid is toxic for the personnel, for surgeons, nurses, but it was a great discovery because it decreased the likelihood of surgical infection. So surgical infection after the surgical operation was usual. Some surgeons thought that pus is good for the wound, and it was hard to believe that it is possible to make surgery without infectious complication, without surgical site infection. But now, after the invention of the antisepsis using carbolic acid, surgical wounds did not complicate with surgical infection. Okay, now we also use methods of antisepsis. We use solutions to kill microorganisms. We use these solutions to wash our hands, to wash the operating field before the incision, and also some instruments are placed in the antiseptic solutions. These methods are called antiseptics. But now about aseptics. So these methods I described just dramatically decrease the quantity of the microorganisms. But we also have methods which totally eliminated any microorganism, including bacteria, viruses, fungi, prions, or spores of the microorganisms, because spores are very resistant. And among many methods, generally 3 methods are used for asepsis. So they are called methods of sterilization. Sterilization means killing any microorganism and its spore. Such clean device or instrument is called sterile. So we use mainly 3 methods. It is steam under pressure or autoclaving, dry heat sterilization, and ethylene oxide gas sterilization. Now, what is the principle of the autoclaving or sterilization with steam under pressure? In normal situation, when atmospheric pressure is 1 atmosphere, the water boils at 100 degrees. It is well known, isn't it? but 100 degrees Celsius is not enough to kill all the bacteria, fungi, spores, and viruses. We need 120 degrees. How to force the water to rise its temperature till 120? It's easy. We must increase atmospheric pressure. So autoclave is the device like this. It is closed, totally closed device, and inside high pressure is created. This is manometer to measure the pressure inside. So during 2 atmosphere pressure, water boils at 121 degrees, which is enough to kill all the bacteria, fungi, viruses, and spores in 15 minutes. So this is the autoclave, horizontal autoclave. This is vertical autoclave. So look at it. It is also closed tightly because inside the pressure is high. This is manometer to control the pressure inside. This is electrical board to control the temperature and pressure inside. This is a huge autoclave for large operating theaters and many operating theaters. Dry heat is just oven, and 160 degrees Celsius is just dry heat, ordinary heat, nothing else is used to sterilize the instrument. Of course, it kills everything, every viruses and so on, but also can damage fabric, plastic, rubber material. Also, heat can spoil metal instruments, especially sharp and cutting instruments. That's why it is used to sterilize only large, bulky instruments. And others are sterilized by autoclave. This is dry heat oven, dry heat sterilizer. Such sterilizer is used very often in dentist clinics, dentist offices. This is another. Okay. So please remember 2 parameters of sterilization. Steam sterilization parameter, it is 121 degrees Celsius and 15 minutes. And second parameter, it is 170 degrees, 60 minutes. And now gas sterilization. So ethylene oxide is the gas which is used for sterilization. In contrast with the heat sterilization or autoclaving, it needs much more time, each 10 hours. Yes.
Sorry, I think the students are asking as well. My question is the same. You said 15 minutes, but in your previous slide it says 13 minutes for 121 degrees.
On
the previous, before this, if you carry on going back.
I said 1 hour, 160 degree, 1 hour. Yes, 100. When
they're not talking about the dry heat, sir. They're talking about the autoclave.
Just a second.
Autoclaving, sir, not dry heat.
Sorry?
They're asking about autoclaving.
Autoclaving, okay.
Yes.
Okay. Which one? Autoclaving. So parameters for the autoclaving is 2 atmosphere, at 2 atmosphere, the water boils at 121 degree. So temperature of the steam is 121 degree, and 15 minutes are enough to kill anything, any bacteria, fungi, spore, rust, etc. So actually 13 minutes is enough, but to be sure, 15 minutes is the standard. But besides these autoclaving parameters, also there are local regulations. According to these regulations, for example, here in Georgia, as I know, current regulations say 20 minutes. Why is it? Why such difference is in these regulations? So when you start to count the time, it is important. So you must start timer when temperature rises up to 121 degrees. At this moment, from this moment, sterilization starts. But when the device reaches 121 degrees, it sometimes needs 30 minutes or more to reach this temperature. Okay, and also the scoring on the device can show several seconds inaccurate data. That's why, to be sure, they increase the sterilization time. And also, besides this, also they control if the steam temperature reached the 121 degrees. And we use special strips for that. I will show. These strips. So there are strips for the autoclave or gas sterilization. These strips are placed inside together with the instruments, and they change color if the temperature inside autoclave reaches 121 degrees. Why is it important? Because sometimes when control system or these devices fail, especially in very busy operating theaters, they work actually 24 hours a day. And when control system fails, it can show that temperature is high, but really the real temperature inside can be low. And this can cause infectious complications and actually can kill the patient. That's why, to be sure, everything is controlled using strips. These strips are necessary, mandatory for sterilization process. So you must know that 15 minutes are standard of the sterilization, 121 degree, 15 minutes, and also placement of the strips which change color at 121 degree also is mandatory. Okay, so ethylene oxide is actually gas, but is pumped into the such balloons, and under pressure is liquid. And then this is connected to such devices, and concentration is created inside. It needs 8 to 10 hours, so it is disadvantage of this method. Also, it is flammable and it is toxic for personnel. That's why it needs several minutes after the sterilization to evaporate all the ethylene oxide from equipment before use to avoid toxic effect. If this fluid gets skin surfaces, they can irritate or cause chemical burns. But this method is excellent for heat-sensitive materials and instruments, rubber, plastic instruments, cutting instruments, and it replaced soaking in antiseptic solutions in modern operating theaters. Now, hand scrub routine. Okay, we killed the microorganism on the instruments and gauze. We killed microorganisms on the skin of the patient, but also we must kill the patient on the skin of the surgeon and nurses. So hand scrub, hand wash is necessary. So 5-minute scrub before the first case and 2-minute scrub between cases is necessary. Fingertips, nails are areas of most concentration of bacteria. Antiseptic solutions used for hand wash is chlorhexidine and iodophos like betadine. Also, alcohol-based solutions like triclosan or sterilium. So, first stage is hand wash with soap and water. Soap removes grease from our hands. So grease is normal component of our skin. So everybody has skin appendages on our skin, which releases some grease. But to be effective, antiseptic solutions need grease to be removed. That's why warm water and soap removes grease from our hand. But hands are not sterile because we wash hand just with ordinary water from the tap. Then, in order to kill microorganisms, we must make hand rub. Hand rub is rubbing the skin with alcohol-based formulations. And surgical hand scrub is hand wash and hand rub together. So first, before surgery, we make hand wash and hand rub. And now our skin contains minimal amount of microorganisms and we can touch the surgical wound without contaminating and causing surgical site infection. Now, please listen carefully how to wash hands. So first, we wash palms like this, circular motion. Both palms are washed. Then we wash dorsums of the hand, like this. Dorsums of the hand. Then spaces between fingers.
Hello, doctor. Can you repeat? Excuse me.
Okay. So first palms, then dorsums, like this. Between fingers, like this. Between fingers. Back of the fingers, like this. back of the fingers. First finger. And nails. Like this. So now when it is necessary to wash hands, this is the instructions from the World Health Organization, how to wash hands. So hand hygiene is necessary in healthcare. Any nurse must wash, or doctor, any kind of doctor, must wash hands before and after. So before patient contact, before any aseptic task like injection, for example, after exposure, risk of the body fluids, any fluid, after contact of the patient, and after the contact with patient surroundings. For example, stool at the wards, or maybe cushion of the patient, or bed of the patient, anything. Washing hands is necessary. This is the statistically most often missed areas during hand wash. So red areas are missed during the hand wash. That's why please pay attention at these areas. So first finger and tips of the fingers mainly. So this is the actually hand wash procedure. In this case, this person uses betadine solution and special brush for hand scrub. You can watch video of the hand wash as well as gowning and other videos on my webpage. Just next to the to this presentation. So now preparation of the operating field. So everything which is in contact with the surgical wound must be sterile, including patient's own skin. So that's why we use first ordinary soap and water to remove grease, then antiseptic solutions. So chlorhexidine solution or betadine solution, which is iodophor or complex of the iodine with the organic base. These substances are used to prepare the operating field. Now shaving. So it depends on the operation, but operating field can be covered with the with hair. So that's why it needs shaving, but you must instruct the patient not to shave at home. Shaving must be done immediately before the operation. Otherwise, small scratches on the surface of the skin during shaving can get infected, and it accumulates the infection and increases the risk of the surgical wound infection. Okay. So in the operating theater, povidone iodine or betadine scrub is used. Then skin is rubbed with alcohol or triclosan solution in alcohol. After that, the sterile drape is used to cover everything around the wound, because you accidentally can touch surroundings of the patient and then transfer the infection from non-sterile things to the surgical wound. That's why draping is important. We actually don't use the alcohol solutions of the iodine in modern operating theater, but any iodine solutions must be avoided in genital areas like perineum, genitalia, face of small children. In case of iodine sensitivity, isopropyl alcohol or ethyl alcohol solutions are used. Okay, we must wear also sterile wearing, and we must put sterile gloves before surgery. But it is necessary to follow rules how to put the gloves and gown. Otherwise, you can contaminate them, and after the contact with the surgical wound, the wound gets infected. So this is the stages of the gowning and gloving, and videos of these procedures you can also see, find at my webpage. So we prevented surgical site infection, just ordinary purulent infection, but also there is a blood-borne infection. So infection which can be transferred with the blood of the patient. Mainly it is hepatitis virus, B and C, and acquired immunodeficiency syndrome. So you must wear gloves, masks, goggles during surgery. Immediate hand wash and wash of the other skin surfaces after the exposure of the blood. You must avoid contact with the needles, sharp instruments, avoid cuts, accidental cuts. Also, avoid direct contact with the wound of the patient. Also, it is necessary to get vaccinated against the hepatitis B virus. Everybody which work in the operating theater must be vaccinated against, and also in laboratory, must be vaccinated against the hepatitis B virus. Nosocomial infection. So nosocomial infection is the same hospital-acquired infection or healthcare associated infection. We treat patients in these facilities, and we fight against infection using antibiotics. But the side effect of such measures is the increased resistance of the microorganisms against antibiotics. So actually, this is the selection. All the microorganisms which are sensitive to generally used antibiotics are already killed, and only resistant microorganisms remain. That's why such infection, hospital-acquired infection, is difficult to treat. major sites of the nosocomial infection. It is catheter-associated urinary infection. If contaminated, catheter can infect the urinary tract, which is mostly sterile. Sometimes it is populated by microorganisms without any infectious process, but in most cases it is sterile. But catheter can insert infection. Ventilator-associated pneumonia. So respiration machine can contain microorganisms which can infect actually the patient and cause a ventilator-associated pneumonia, which is difficult to treat because of resistance. Surgical site infection is also a common site of nosocomial infection, and central line associated infection around the central vein catheters. So this is the redistribution of the sites of nosocomial infection, and look at it. Main part is urinary tract infection or respiratory tract infection, surgical tract infection, skin and respiratory tract infections. So upper respiratory tract and lower respiratory tract infection. Other kind of infections are rare. So which microorganisms are resistant to the generally accepted treatment and are dangerous? It is methicillin-resistant Staphylococcus aureus. Vancomycin must be used against these microorganisms, but also vancomycin resistance against the vancomycin is possible. Pseudomonas, Klebsiella, Escherichia coli, and Clostridium difficile are microorganisms also which cause post-surgical nosocomial infection. Clostridium difficile causes the colitis, acute colitis with diarrhea, fever, and also intoxication. Its toxin circulates in the bloodstream with clinical consequences. Viruses, it's hepatitis A, B, C. B and C are bloodborne infection. A is gastrointestinal tract infection, and also human immunodeficiency virus. And among fungi, most fungus is the Candida albicans. Okay, how to prevent contamination of the patient with hospital-associated infection? First of all, in every hospital there is a committee. It is multidisciplinary infection control committee, which plans the methods of prevention. Also, this committee monitors infections. It makes bacteriological investigation, takes specimens from wards, from patient facilities, from door handles, from corridor, from nurses' hands, and finds which microorganism is associated with these facilities and how to fight against that. Education and training is obligation of this committee. So hand wash popularization, supply medical staff with antiseptic solutions, Also, management of the waste is necessary to prevent spillage of the hospital-associated infection. So we must employ the optimal use of antibiotics. So antibiotics must be used when necessary, and not only on every case. Some scientists are against prophylactic antibiotics. So, for example, clean operations like hernia surgery, in most cases, does not need any antibiotic coverage. To tell the truth, I also use in such case antibiotic prophylaxis, but some surgeons consider that it's better to avoid usage of the antibiotics and use antibiotics only in case of infectious complications. De-escalation. So it is the principle to use to quickly switch to the appropriate antibiotic from the wide spectrum antibiotic. We expect the antibioticogram sensitivity data of the microorganisms and switch from the wide spectrum antibiotics to the appropriate antibiotic, which is most effective against this particular microorganism. Prevention measures are cultures of the microorganisms, isolation, identification. Zonality is very important principle. For example, operating theater is totally isolated from the rest of the hospital. And you cannot just enter the operating theater. You must pass through the lockers, change your wearing, and food covering is necessary to access the operating theater. Sometimes it's necessary to take shower before entering the operating theater. And also inside the operating theater department, there are some zones with which are less sterile and most sterile. Moreover, inside one operating room, there are zones that are more sterile, and if you don't wear sterile wearing, you must not enter the sterile zone. Only completely equipped personnel, nurses, or surgeons or anesthesiologists can enter sterile zone. Just near the instruments, surgical instruments, or the patient itself, or operating field. This is the principle of zonality. And medical waste management. So all the medical waste is classified. A class, it is the Georgian A. B, and the third letter in Georgian alphabet is G. So ABC. So blue color containers are for harmless waste, harmless medical waste. Yellow container is for dangerous or risky waste. And red containers are extremely dangerous waste. This is the sign of biohazard. You must avoid contact with the container with this sign. And also sharp instruments like tips of the syringes or scalpel tips must be kept separately in hard wall container to avoid accidental damage of the skin by these sharp instruments. After using, so we use two kinds of instruments: single use instruments and reusable instruments. So single use instruments must be discarded after the single use, like syringes, okay? But reusable instruments must pass through these 3 stages. First is decontamination. So instrument is placed is soaked in the antiseptic solution. It is washed. All the remnants of the biological tissues or blood are removed. Then it is disinfected or soaked in the strong antiseptic solution for several minutes or sometimes several hours. After that, it is washed again to remove the disinfection solution, and it is sent to the sterilization department, where it is placed in autoclave, heat sterilization oven, or in the ethylene oxide camera. How infection is transferred? So there are several ways of transmission of infection. First is the direct contact. Direct contact, droplet transmission during the coughing, sneezing, talking, and such transmission needs short distance, because these droplets go down and does not reach long distance. But look at it, airborne transmission. This is when droplets are very small. Small particles, less than 5 micrometers, stay in air for a longer period, and they can transfer microorganisms like Legionella, air conditioner disease, you know, Legionella, Mycobacterium tuberculosis, or viruses. Vehicle transmission is the transmission with food, water, medications, devices, equipment. And fourth route of transmission is vector-borne transmission. So mosquitoes, flies, rats, and etc. Okay, I think it's time to complete today. Do you have any question? Hello, any question? No? All right. See you next time then. Goodbye. No, so we did not finish that presentation, but we will continue from the last slide next time. You have another lecture for anesthesiology. I think after the next lecture, 4th, 5th, and 6th lecture will be delivered by anesthesiology lecturer, and I hope he or she will also provide with presentations and other lecture materials. Okay then, see you next time. Goodbye. Thank you for your attention.